Good afternoon, everyone. I think we're just about ready to kick off this webinar. So I'm just going to go through a few bits of housekeeping at the start here and let you know what we're going to be talking about over the next hour or so, maybe slightly less, depending on how many questions we get. So the first thing to say is with regard to questions. Please do type these into the question box, and at the end of each of the sections that this presentation is split down into, I will go over the questions and try to cover everything off. The slides are going to be sent out after this webinar is over, and this is going to have my contact details on, which are also on the title page that you can see at the moment. And the final piece of housekeeping is that there is no planned fire drill today. So if you hear a fire alarm, it means that the social finance office is probably burning down. Okay, so let's get going. My name is Harry Hoare. I'm an associate at social finance, and I've been here about 3.5 years now, and I've done a number of SIB feasibility studies in the area of trying to prevent vulnerable children from entering care, trying to help rehabilitate people who are suffering from drug addiction, and trying to address the harms caused by alcohol and problem drinking. So I have a little bit of practical experience around developing social impact bonds. So that's where I'm coming to this presentation from, and hopefully I'm going to try to weave some of that experience into the more theoretical concepts that we're going to talk about today. So this presentation is broken down into 3 sections. First off, I'm going to try and set the scene and say why I think investment in prevention is required and why it's a good thing, to hopefully frame the reasons why you should be interested in listening to a value for money case. So we're going to go over the key questions that you need to address when you're trying to build a value for money case, and finally the activities required to answer those questions. And then in the next steps we'll talk a little bit about some of the support that's on offer from a big lottery fund to help you develop these ideas if you're a commissioner. So kicking off, what is the need for prevention? Well, the demographic trends in the UK at least, and this is shared across most of the developed world, is that the increase in population and an aging population is putting a lot of demand on the acute end of services and is making the need for prevention greater and greater. So you can see the bullets that I've chosen to highlight there. So just a couple of stats to back that up. In the UK, the government's affordable housing programme gets allocated £4.5 billion over 4 years, but the spending on housing benefit is £22 billion every year. So the amount that actually goes on building new homes and trying to prevent the issue is a quarter over 4 years of the annual bill on housing benefit, the amount of money that goes to support vulnerable people to sort of make their rent. Another stat for you on the need in housing is that recently in 2012, £2 billion was spent on housing vulnerable homeless families and temporary accommodation. So those are B&Bs and things that are unsuitable for families really, when what they're after is a long-term solution that helps them bed down in a community, find schools for children and so on. So sort of, again, it's a problem that's bubbling towards the acute end rather than having a preventative approach. I'll just give you one on these other 2 areas. Around people living longer with diseases, stat here is that the Centre for Disease Control and Prevention, the CDC, noted that death rates for those with diabetes dropped by about a quarter between 1997 and 2006. So that in itself is obviously a great news story, but it means that the number of people living longer is going up because we're getting better at addressing diseases. And this clearly puts an extra strain on the health service. Finally, around children coming into care, the total number of children in care in England has grown steadily at 3% for the last 5 years, and residential care for the most needy children can cost upwards of £180,000 a year. So this is a big problem in this country at least, and something that causes high social cost but also high financial cost. And these points are really brought together in the graph that you can see in the bottom right-hand side of the screen here, which is known colloquially as the graph of doom, because as you can see, the amount of money is going down, but the need is going up. And this is the sort of context in which we feel prevention is so sorely needed to address these problems upstream when the cost of addressing them is reduced and where the problem is potentially easier to address and stops it from growing into something worse down the line. So if we can all see that prevention is so clearly needed, why isn't it being done? Why aren't commissioners putting more money towards preventative problems to try and address these things upstream? Well, one of the most obvious ones is that these problems are more obvious at the acute end. When someone turns up on the door of services, so at the police station, at A&E, then that's where the problem is really visible, and that's where it's there's a clear duty there for the service to provide emergency health care, or if it's in the criminal justice situation, to arrest someone that they see committing a crime. In terms of the main barriers that we've come across in our work with commissioners, is that often there are unlimited resources to invest in innovation and prevention. A lot of the time, preventative services have a less well-established evidence base, and so it's difficult sometimes to see whether you're getting value for money for this. Prevention can be quite a risky business. Not all preventative programs work, and there are many examples of things that the government and others have tried in the preventative sphere that haven't quite come off. One good example I like is the crime reduction initiative that was tried in the mid-90s in England and Wales, and it did manage to reduce crime in a third of areas, but crime also went up in a third of areas, and a third of areas crime neither went up nor down. So I think the impact of that is reasonably limited. And then finally, in terms of insufficient information, often it's difficult to know the actual cost of the existing problem, and so exactly the financial cost and also the human cost of a particular issue. And this is three of the main barriers that SIBs are designed to try and overcome. To provide that upfront funding to invest in prevention, to take the risk away from commissioners and put it with investors, so the risk that outcomes will be achieved as the program works. And then finally, to collect as much data as possible and learn about what works and evolve the service over the life of the program. And this is really what we're learning in Peterborough, the social impact bond to address reoffending among short sentence offenders, which we will touch on later in the presentation. So I guess it's important to think about how a SIB actually works. So I've talked about how it might be able to overcome some of these barriers, but the obvious question is how does it in fact work? And there are three main counterparties to a social impact bond, three main organisations or types of people that play an important role here. First off, you've got the commissioners, those people who commission services who are either preventative services or at the acute end. So in this case, it could be the Ministry of Justice who are providing courts and prison for those who commit crime. You have social investors who are investors who are interested by having a social impact as well as a financial return, and in some cases might be willing to accept a lower financial return in order to create a social impact. And finally, you have delivery bodies. These are voluntary and charitable organisations that deliver services. So in the Peterborough example, there are services that help resettle offenders when they're released from prison, some that help around mental health problems, getting offenders back with their families, providing them with activities to do, and generally trying to meet the needs that people have when they are released from prison. So these are the three different types of organisations or counterparties, we say in the technical term, to a contract, who are involved in the social impact bond. And what it tries to do is bring these three together. So first off, there's a contract between the commissioners and the investors that commit the commissioner to pay for improved outcomes. So in the Peterborough example around reducing reoffending, the metric is reduced reoffending in the year after release of short sentence offenders. The reason that the commissioner cares about this is that reoffending is really expensive. Catching criminals, putting them through the court system, and then putting them in prison is an expensive process. You have victims of crime as well, and there's a high social cost. It's not great for the individual involved either, and this is why the social investors are interested in this. So they, the conversation is had in which, what is an avoided offence worth to you, Ministry of Justice? They put a figure on it, and then we think, right, actually, we think that the evidence base around what delivery bodies do in this area, provides potential for being able to deliver a service that could make money and produce a social impact. So the way that the contracts work is a link between the social outcome, in this case reduced reoffending, and cost savings to the commissioner through avoided court costs and avoided people going back into prison. So on the back of this contract, the social investors will seek out delivery bodies who are able to provide services that can deliver on the agreed outcome. So we need to find charities who have got experience and evidence of being good at working with short sentence offenders on release. So it's a research task to try and find the right kind of people with the right kind of ethos who are able to do this and engage them in order to deliver services. The investors provide upfront investment to these organisations, and again, in the technical term, take away the working capital strain. So they get funded at the beginning of the year for the work that they have to do over that year, rather than being paid at the end of the year for all the work that they've done. To any of you who know anything about the supply chain of a supermarket will know that the really large supermarkets don't pay any of their suppliers for 90 days after they take delivery of the goods. So there's, as you can imagine, a massive working capital strain in order to basically keep yourself going for 90 days without getting paid for anything. So what the social investors are doing here is de-risking the delivery body, saying that your payments are upfront, they will flow as long as your performance is up to appropriate standards. The delivery bodies then deliver a service which is designed to meet the social goal, and if there is an improvement in the social outcome, such as reduced reoffending, then the commissioner, under the contract that was drawn up right at the start, has to pay out to the social investors. And so that's how they potentially stand to make a return. One of the questions that we often get asked is what return are the investors going to make? And there's no simple answer to this because it depends on the risk of the particular program and also the amount of social impact that can be generated. So if a program is very high risk and the impact is low, then it means that the investors might demand quite a high return. Flip it around, and if the impact is potentially really high, then the social investors might be looking for a lower return because the social impact sort of makes up for the lower return. Do we have any questions on the SIB model at that stage? I'm not getting any through, so I'm going to keep going. Oh, yes, we've possibly got one coming through here. Bear with us a sec. I think it's just being typed out. The question is, why don't the commissioners give the money straight to the charity organisations? So, in many cases, many sort of with the existing services, that is exactly what happens. But in the social impact bond case, there's a couple of reasons. So one is that there's an additional amount of rigour brought by the investors, so a kind of business mindset to solving social problems. We create a performance management network and a sort of data-rich environment. And there are some reasons to think that this additional investment rigour increases the likelihood of achieving good outcomes. In a sort of payment for outcomes model, so if instead of a sort of straight-up fee-for-service model, but payment based on outcomes, so whether reoffending is reduced, the delivery organisations hold quite a lot of risk. So let's say they deliver their service for a year and then the results come out and reoffending hasn't gone down. It means that the charity has spent a year's worth of resources delivering a service for which they don't get paid for. On the other example, there's sort of the other way of doing it, a fee for service. So the commissioners give money to the charities without any reference to the performance. Then it means that the commissioners will end up paying whether, in the example, reoffending goes up or goes down or stays the same. So basically, in that model, the commissioners hold all of the risk because they're paying out whatever happens. So just to recap on that, in a fee-for-service model, the commissioners hold all the risk, and there aren't any incentives on the charity to really rigorously focus on performance. In a payment by results model, the charity holds all of the risk and might fail to achieve outcomes, so could end up bankrupting itself. Whereas in the social impact bond model, it's the social investors that hold the risk as to whether outcomes are improved or not. And there are a couple of reasons why this might be good, such as the data-driven environment and the performance management. So I hope that makes sense. Okay. So in terms of the key questions to ask when building a SIB value for money case, first thing to sort of walk through is what is a SIB value for money case. In our work developing social impact bonds, there are sort of two main problems that we think they might be able to help solve for commissioners. One of these is around avoiding paying for failure. So this is what I just described as the fee-for-service model. If the commissioner pays whatever happens, then they end up paying if the service doesn't work. Problem two is around financing innovation. So being able to put money towards innovative programs, some of which inevitably will fail. So how do you try and promote innovation and new ways of addressing social problems when you have limited resources, but without paying whether it works or whether it doesn't work? So this is what the social impact bond tries to deliver. So the Essex social impact bond was around trying to prevent vulnerable children from entering care, and the intervention used in that model was multi-systemic therapy, or MST. And this is a highly evidence-based intervention. It has lots of evidence, particularly in America, what are called randomized control trials, which people often refer to as the gold standard of evidence. It means that they've taken a very scientific method to the way that they measure the program. And so there wasn't so much innovation here. We weren't creating a new model, but we were introducing an intervention which hadn't been used much in the UK in a new area around social care, when normally it's used around youth offending. The main argument for this Essex SIB was that if you can prevent a certain number of children from entering care, the local authority stands to make some very good savings. I said at the start how expensive some of the care placements can be, and one thing to bear in mind is that these care costs are compounded over many years. So a child who enters care as an adolescent spends 3/4 the rest of their childhood in care, and these placements can be really quite expensive. So that's one of the main arguments is around this sort of this cost-saving argument. On the other side of the other end of the spectrum is the Greater London Authority SIB, and this aimed to try and address the needs of entrenched rough sleepers. These are guys who will sleep rough for the vast majority of nights and are very difficult to engage, and with the existing services haven't really found a way of cracking the nut and being able to get them into stable housing or stable healthcare. And so it was realised quite early on that a new model of how to address needs was required. And so social impact bond way of financing innovation here is by investors taking the implementation risk and trying a new program, trying to evolve it, and sort of bearing the risk that this innovative new program that has high potential social impact may or may not work. The argument for the Peterborough SIB tries to bring the two of these together because there are potential savings around prison costs, but also it's an innovative model of bringing together a coalition of around 4 or 5 charities that are working together to try and reduce reoffending. So I think the innovation there is on pulling all the different elements of the service together sort of under one banner. So the value for money case is what we've got here as problem one, trying to introduce a new service which can deliver cost savings for the commissioner. So it's a preventative service that, if it works, will save the commissioner money down the line, whether that's care costs, prison costs, or health costs, for example. And how does the SIB value for money case work? Well, what this diagram tries to show is that the existing cost of the problem, you can put a monetary value on. So you look at the data and you say, okay, an average care placement costs £10,000, an average prison placement over a year costs £20,000, and you can start to do some calculations as to what the cost to government or commissioners is for a certain problem. What the SIB intervention does is tries to improve the social outcome, and as a result reduce the amount of social costs involved. So again, in the Peterborough example, reducing the number of people going into prison means that you have a reduced cost to the government. So what you need to look at under the SIB is, so firstly, what is the impact of the SIB, i.e. how much cost does it take out of the system, but then what is the cost of the intervention of providing the service, plus what is the return that goes to investors in order to pay them back for having put their money at risk. And so when a SIB model does work, the overall amount of money taken out of the system minus the investor return means that savings are retained by government. I'm just going to pause briefly at that stage to see if there are any questions on that one, because I understand that that is not the most straightforward of slides, but if everyone is happy with it, I'm going to go on. Basically, what we're looking for a SIB to work, and we do try areas and we do the calculations and realise that SIB might not be the best way of working. In areas where it does work, it's all about delivering high savings to government, which cover the cost of the intervention and the investor return. So that's the basic premise, and that's what we're talking about when we talk about a value for money case. And as you can probably think and understand, there's a range of whether the net savings to government is likely to be small or large, and so the value for money case can either be strong or weak based on that. And it is one of the elements that you might want to consider around whether a SIB is a good idea, in addition to what the social impact might be and the level of innovation around the service. So, moving on to the main activities required to answer the question. So, what we're looking for when a SIB value for money case is going to be a good one is, as I said, the net savings to government are larger than the cost of the intervention and the return to investors. So this slide kind of talks through what are the main activities and what are the key questions. We've broken it down into 4 areas here. So the first part that we try to look at is understanding the needs of the people who are affected by the problem. So again, referring to the reducing reoffending example, what are the issues that short sentence offenders have when they're released from prison? Well, some of them are as follows. Having spent time inside means that it's difficult to maintain contact with your family. You might become estranged from your family. You potentially pick up drug and alcohol problems in prison. You may have lost your job, you may have lost your housing, and you've just spent a large number of months at Her Majesty's pleasure rather than being able to do what you want. So as those prison doors close behind you and you have £46 in your pocket, it's very difficult to think about how you're going to sort of move back into the community, into a sort of normal life around, and get your problem sorted. So the transition between leaving prison quite a difficult one to try and get past. So what we look at when we're sort of trying to understand the needs of the individual who's in that situation is how does it sort of play out? Why does someone suffer from this problem? What are the barriers to achieving better outcomes? And what is the sort of day-to-day story around this problem? We also need to focus on who suffers from this problem, i.e. the target population. And once we start, in terms of the activities required to do that, we'll come on to that in a second, but I'm sure you can can understand. It's about getting out there, talking to frontline organisations, talking to service users, trying to build up your understanding of what the issue is. Once you've got a handle on the needs, you can start to think through what the costs are. So what's the typical journey of a service user, or someone a child in care or a short sentence offender, and what are the costs related to this? There's a very helpful unit cost database which was recently published by the Cabinet Office and New Economy Manchester, which has a vast range of unit costs for everything from a kind of a care placement to an A&E visit to an ambulance call out. And this is potentially quite a helpful starting point to put a monetary figure, be it a kind of national level one, on some of the unit costs around different social problems. So once we try to map out what a service user journey is, you start to attach costs to that, and you can see whose budgets these costs fall on. So is it the health commissioner? Is it the local police and crime commissioner? Is it public health? And so on. To try and get a sense of which commissioners you should start to talk to, who might be interested in ultimately paying for the improved outcomes, as the Ministry of Justice did in the Peterborough example. And so assessing the potential interventions is really linked to understanding the needs. So you want an intervention that has got a strong evidence base for being able to meet the needs of the target population and overcome the particular barriers that they face. We don't always religiously follow evidence-based programs, but it's a spectrum where the stronger the evidence, the less risky the proposition is for investors. So the lower rate of return that they will require in order for you to put their money at risk. Some interventions we might try and create something new from reading the research and from talking to charities and service users, but to try and make the sort of the best possible case for an intervention. Those that do have randomized control trials or have been used in many different areas in either the UK or similar countries, that's quite helpful for the evidence base. And so finally, around valuing and measuring outcomes, this is really where you do the sums that were on the previous bar chart and look at whether the effect that the intervention is able or likely to achieve is going to produce enough cost savings to pay for itself. So this is why you really need to build it up in these steps, because you need to understand what the costs are and also what the impact of the intervention is before you can try to work out whether there's going to be a value for money case. The value for money case comes at the end because it pulls together what are the current costs, what's the potential impact of a new service, and also what's the return that investors are going to demand for their money. And what we do at Social Finance here is generally to build a financial model using Excel, which makes a prediction of cost savings and how they might flow over time. So whether it's something that happens right at the start of the program, or whether it's benefits that happen later down the line. For example, there are some programs where, for example, health benefits will be seen over a large number of years rather than a kind of immediate immediate payoff, which you might expect if someone avoids a prison sentence. So that's quite theoretical. So in order to try and bring that to life a little bit, I'm going to go through those 4 areas and kind of talk a little bit about how we sort of do that in real life. with some examples. So when we were working around recovery from drug and alcohol addiction, there were some research reports out there around various different programs, but we felt it was really important to capture the user voice in this, in the local area that we were working in, to try and understand what were the needs of our specific target population. So along with a colleague of mine, we did a series of 50 service user interviews, which took us across the county of Essex, and I spent a rather interesting day at the methadone clinic in Clacton, trying to persuade people who are recovering from addiction to talk to me, and so that I could understand to a better extent what their sort of needs were and their barriers to achieving change. We tried to talk to people throughout what the technical terms, different stages of the recovery journey. So those who were who had just considering trying to get into recovery, and those who had tried many times before, and those who had sort of kicked their addiction, 5 years ago, to build up a picture of what the day-to-day experience was like, and what more could have been done to help people achieve recovery, or to do it sooner. What were the triggers for relapse? So inappropriate housing, for example. If you go back to a house where all of your friends and housemates are using drugs, then it's very difficult to try and break free from that. So alongside the kind of service user interviews, we convened roundtables with academics and charities from the sector to sort of put out what our hypothesis was of what a solution might look like, and take their feedback on whether this made sense, or whether it had been tried before somewhere, or just to kick around the solution and see see whether it stood a fighting chance of being able to make a difference. And the diagram here shows how we build out from needs and barriers to interventions that are able to address that, and then finally look at organisations that are able to deliver the intervention. And so this is sort of our, it all comes from understanding the social problem and understanding the needs. In terms of understanding current costs, when we work around preventing care for vulnerable adolescents, as I said earlier, the value for money case for this type of social impact bond is one of the strongest ones. And what we try to do here is work out what the cost of a care journey is. By care journey, we mean for someone who enters foster care today, age 13, what is the likely trajectory for them for the rest of their childhood? Do they spend 50% in foster care, 20% in residential care, 30% in independent placements? What does the picture look like? And fortunately, local authorities in England collect data. It's part of their statutory returns to the Department for Education. They collect data around what care placements each child has had over the years. So what you can do is pull those together and work out what the average length of a care journey is, and what types of placement children are likely to enter. Then what you do is take the unit cost for each of those types of placement, and that gives you a total cost of the care journey. And this kind of methodology is similar to what we use across many different SIB areas. So it's trying to work out what the service use is. So whether it's health services, so A&E, hospital, doctors, whether it's criminal justice services, courts and prisons, and so on, And once you've got a handle on the amount of service used, you try and attach a cost to that, and that gives you an overall cost across different areas. And as I said earlier, what we try to do is understand which commissioners hold these different budgets. What makes things a little bit easier around children in care is that the local authority children's services department holds the care placements budget. So you're having a conversation with just one commissioner if you're working in one area, and that makes things a little bit easier. It's worth mentioning, possibly at this point, that one of the main arguments for setting up the big lottery fund, social outcomes fund, is to try and recognise the benefit that comes across multiple government departments. So instead of having to have an individual conversation with the central government departments, with Ministry of Justice, with Department of Health, with Department for Work and Pensions, instead, if you make an application to their fund, then there is the potential to get top-up payments, so a contribution to outcomes payments for a social impact bond, which recognises some of the benefit that goes to the central government departments rather than the local ones. And this is a point around which commissioners' budgets bear the costs when you understand these costs. So in some ways helpful if it's the local commissioner, but if it's the central government commissioner, it's not necessarily a deal breaker, because there are funds that you can apply to try and achieve a top-up payment. In terms of assessing interventions, as I said, it's really starting with needs and trying to build up from that. This comes from when we were working in Essex and looking at interventions to try and address the cycle of alcohol abuse. And what we're trying to show here is that it's not necessarily a kind of, it's one intervention by itself. It could be a suite of different things. So at the top, it was thinking around an expansion in structured treatment. So that was something that wouldn't necessarily be paid for by social investors, but which the local authority could produce itself. There are person-centered interventions, which are sort of one-on-one key worker and person suffering from alcohol addiction, and who try to sort of work through their problems. There are environmental interventions which look to affect the environment around which people drink. So things that pubs can do, such as serving alcohol in straight glasses rather than pint glasses, actually decreases the rate at which someone drinks, and discouraging rounds of drinks by not having a minimum card limit. All these environmental interventions actually reduce the amount that people drink. Policy instruments around the minimum pricing on alcohol and sentencing when people do commit alcohol-related crime can also play a part. And then there are also community engagement interventions, things such as the SOS bus, which is a double-decker bus that drives to hotspots in Essex and helps deal with alcohol-related incidents. Really what I'm trying to show you with this slide is that often the right approach is sort of multifaceted. It has lots of different elements. So parts of which you might look for an expansion in existing services, introducing new things, changing the environment, working with potential policy levers. So there are different ways that you can address the issue, and it's best to try and work in a coordinated approach with fitting in with the existing services and the forward-going strategy of the commissioners that you're working with to develop the social impact bond. Finally, in terms of valuing and measuring outcomes, I alluded to earlier the Greater London Authority SIB that looked at reducing rough sleeping, and so what we did here was looking at particular outcomes, improvement in social outcomes, and trying to work out what the improvement in terms of cost was. So, in terms of rough sleeping itself, there's a clear social benefit to reducing the number of nights sleeping rough, and the longer term impact of this, if you can reduce the number of individuals sleeping rough, is that you will reduce the pressure on outreach services. Around accommodation, if you can get more people into sort of sustained, stable accommodation, then you'll be able to reduce the amount of temporary accommodation, the number of evictions, and also the links to offending caused by sleeping rough. And there's also a benefit around reducing the number of emergency admissions and getting the people who are sleeping rough into a more kind of sustainable relationship with a doctor who can address their issues earlier on, rather than using sort of A&E when everything goes wrong. So it's about tracing through or finding areas where there's an improvement in social outcome, which is linked to cost saving, and that's where you can sort of bring the two together around the metrics that you might use to measure the performance of the SIB. Moving on towards the next steps, I said earlier that there is support available from the Cabinet Office and Big Lottery Fund, and Social Finance are working with the local government agency to help people, help the pipeline of social impact bond applications to these funds. There are resources available on the Social Finance website and the links there. And really what the support is trying to do is help commissioners develop an idea. So working through those kind of areas that I talked about, understanding the need, understanding the cost, what intervention could help achieve improved results, and how might you think about putting a monetary value on the improved outcomes and cost savings. And so there's a two-stage process to this. The first stage is an expression of interest, and the second stage is full application. So once the expression of interest has been accepted by the Big Lottery Fund and Cabinet Office, there is the potential to apply for between £10,000 and £150,000 worth of funding to help purchase technical support, and this helps flesh out the proposal in the ways just described. In terms of a little bit more detail on exactly what the funds are, so the Big Lottery Fund is called Commissioning for Better Outcomes, and this is £35.5 million in top-up funding for SIBs. The Cabinet Office one is called the Social Outcomes Fund, and that has £20 million. Again, top-up funding for SIBs and other payment by results mechanisms. You'll be glad to hear that there's a single application for both funds, and worth noting that that's available to commissioners in England. I'm not sure if we've got anyone on the line from outside of the UK, but I understand that there are some interesting developments happening on the continent and in America around creating the right kind of infrastructure to support social impact bonds. So in terms of what the funds cover, the main point is around top-ups to commissioners' outcome payments. So as I said, it's around trying to recognise the benefits that accrue to central commissioners by paying a percentage of the overall outcomes payment. But also there's development funding there to help purchase the support that that gets you, over the line in terms of your social impact bond development. Points to note around the outcomes payment. There's no minimum or maximum. They expect the average to be around $1 million, and the average contribution to be 20% of the total outcomes payment. As this is all quite new, this is speaking in quite general terms. So, whether the sort of maximum limit is something that can be tested remains to be seen, and it's something we'd be quite keen to test what the upper limit is. And around the development funding, as I said, it's £10,000 to £150,000, and this can be spent on a list of approved providers, which is available on the Social Finance website. So those of you that are interested and want to take the idea of developing the social impact bond forwards, there are 1, resources, and 2, funding available to help you to do this. So that concludes the main body of the webinar, and if anyone has any questions on any parts of that, I'll be very glad to answer those now in the last 5 minutes. Okay, we do have one question here. I mentioned support to develop the SIB market in continental Europe. So on the Social Finance website, you'll find the contact details of Jane Newman, who is our international SIB director. And her job is to try and help organisations in around the rest of the world to develop social impact bonds. That's her role, and she has done work in America, in Australia, Holland, Scandinavia. She has clocked up quite a lot of air miles, and as I said, she basically provides advice from our kind of UK perspective on initiatives that are happening in other areas. So that's Jane Newman on that one. Got another question here. That we're looking for the document from the Cabinet Office, which outlines the costs associated with various problems such as rough sleeping. I would say shoot me an email and I will send you a link. If you Google new economy Manchester unit costs, I think that's the best offer. But if you can't find it, just shoot me an email. I'll rewind to my email address. Ooh. So my email address is on the front here, harry.hoare@socialfinance.org.uk. Okay then, I think that's about it. So Thank you everyone for listening to me for the last hour, and if you have any questions that you think of after today, please do get in touch, and thank you for your time.